Good afternoon, morning for some of you out there. Welcome to our first long-term care insurance sales bites session of the year. This is Brittany Button, long-term care insurance specialist for Art Jetter and Company, and today we have Sean Britt with Nationwide joining us. As the title of today's session states, we are going to be discussing the current state of the long-term care market in the United States. This will include highlights on planning current and post-pandemic times, the changing face of informal caregivers, and pending state and federal legislation. Now, we will be answering questions at the end of the session, so simply type those into the questions or chat box provided. So, Sean, let's get started.
Thank you, Brittany, and thank you all for joining us today. I do want to apologize in advance. I am having some speaking issues today due to a little bit of illness. So if I may have to stop for a moment, take a sip of my honey tea, but we will get through this today and I will answer all of your questions. And I'm really excited to do this for you today. I just wanted to apologize for me not sounding like my normal self today. So we have a lot to talk about. I'm not going to go through the agenda per se, but we have a lot to talk about, as you can see here. And so we'll go ahead and get started. We're going to start with the long-term care industry and legislative updates. So let's look at the shifting market for a moment. So if you think about long-term care and what was going on back in the year 2000, we were doing pretty well selling policies. We sold 750,000 traditional policies, but something happened. The price increases started coming in like crazy. Interest rates were starting to change. Lessons learned like, oh, gee, we should have been pricing women higher than we did. And all sorts of those lessons they didn't understand when they first started pricing the policy started hitting. Rates start going up. People started getting upset. And by 2017, the number of policies sold was down over 90%. If you look at 2020, we are now down 95% from where they were in 2000. One of the other reasons, however, is that the combo long-term care industry took over. Now, a combo policy simply means any long-term care coverage that is tied to either a life insurance policy or an annuity. So any of those would be considered a combo policy. As you can see, those policies started picking up. There was a little downturn in 2020, but they have picked up, and 30% of the sales are now linked benefit policies. People really like these. But here's the thing. We still aren't selling 750,000 policies. If you add the 49,000 of traditional policies to the 421,000 of combo policies, we're not even at 500,000. So we still need to do a better job of talking to our clients, and we still have a huge opportunity because less than 8% of people over 50 actually have any type of long-term care coverage. So there's a big opportunity out there. Now, if you've heard me before, I am a stickler. Don't sell with statistics. They don't work. But it's good for you to know these things, or if you happen to have that detail-oriented client, such as an accountant or an engineer, and they ask you these questions, you have the answers. So if I were in front of you live, I would be asking you which one of these statistics do you think is true? Number one, 70% of long-term care claims begin at home with home care, or number two, 70% of people over age 65 will need long-term care. Now, so far I haven't traveled a lot because of COVID, but in the audiences that I have shown this to, most of them answer number two. But in reality, it's actually number one. 70% of claims now are beginning at home. And that 70% statistic you've seen all over marketing materials everywhere, about 70% of people needing long-term care, it's a flawed study. 70% of people may need long-term care, but they're really not talking long-term care. They're just talking care when they're over 65. I mean, for something as simple as they stubbed their toe. I mean, I'm being a little cynical here, but the study did not base their statistics on true long-term care needs per the federal definition. They just like somebody needs some help for a couple of weeks because they fell and they're bruised and it's too hard to do something for a week or two. Those people were included. So if you actually take those people out of the study and just count the people who have legitimate long-term care needs, it's 52%. Now that's still a lot of people. And as I said a few minutes ago, less than 8% of people over 55 have coverage. So this is an open market for you. So home health care is the new 70%, you might say. It has totally taken over the industry. And for years, the home health care statistic hovered around 52 to 54%, but it's now up to 70. And part of the reason for that is COVID. Assisted living has finally surpassed nursing home care. It's at 18%. And this is where claims start. Now, of the 70% of claims that start in home care, 80% of them will make it almost to the end in the home. And again, it kind of depends what is going on with the person. If, a lot of people, your more middle class people may stop the home care when the cost of it exceeds assisted living, and then they'll cut their losses and move on to assisted living. Because of the pandemic, 89% of families now would they were considering switching to home care, even if their family was already in a facility. If it were possible to bring them home, they were bringing them home. That's why the facility rates of, they were not filled because people were bringing their family home. Now, I'm not going to go through all of these statistics. You'll get a copy of this presentation and you can look through this. But you notice I have circled in red regarding the homemaker and home health aides. Now, this inflated number is important because for the last decade, the inflation to homemaker services and home health care aides was somewhere between 0.5% and 1.5% a year, depending on the year. But because of COVID, it has skyrocketed up into the 4s, which we've never seen with home health care before. We just have never seen that. And all of these, the only thing that decreased was adult daycare, and that's probably because people weren't putting their family in them. They were working from home, so they didn't need to use the service. But we've got labor shortages, employee recruitment, retention challenges. There's so much more equipment, masks, even shields, more of the hospital coats, just keeping people safe who are caregivers, pressures on paying people more, regulatory changes, and just pure supply and demand. There is a shortage of caregivers. There has been for a while, but COVID just escalated that problem. This quote from the Wall Street Journal I find is very appropriate. The pandemic is reshaping the way Americans care for their elderly, prompting family decisions to avoid nursing homes and keep loved ones in their own homes for rehabilitation and other care. And it's believed this is not just going to end if all of a sudden COVID were to stop tomorrow, it's going to have a lingering effect. So in some studies that have been done, 2/3 of the respondents will tell you that COVID has totally changed their opinion about the best way to care for older adults. And they no longer are sure they can get quality care for their loved one in assisted living or other type of congregate settings like nursing homes. And they do plan to use in-home care rather than facility care, even looking past the pandemic. And they also say, 3/4 of respondents are concerned their loved ones will contact COVID in a facility. Now, I just told you that there is a shortage of paid caregivers. And so that means more of us are going to become unpaid informal caregivers. Ironically, that is something that gets studied. AARP does a study every 5 years about caregivers. And so this is going to show you the changes. So Generation Z, they were not caring for anybody in 2015, but they're trending up now. It's still a small percentage. These are probably people either helping take care of grandparents or maybe a parent with early onset dementia or early onset Alzheimer's. Millennials, they're right where they were. 23% of them are caregivers. Now, the interesting thing is the next two categories. Gen X are moving up. They're still below the baby boomers, and look at the baby boomers, they're going down. And what's happening is the baby boomers are starting to trend down as caregivers and are going to trend up as the cared for. And then the silent great generation, they're combined because there's so few of them left. They are trending. Basically, it's down to 7% of that generation are caregivers, and it's usually an elderly spouse taking care of the other elderly spouse. So the boomers are still the most predominant, but they're transitioning again to be the cared for. These are the people who need insurance now. There's no time to wait. They need it now while they're still insurable. Now, other challenges facing caregivers, 25% of informal caregivers are sandwich caregivers, meaning they're caring for a parent as well as raising children, and they average just 41 years old. And again, the pandemic has created a lot more of these people. Millennials, this has been going on for a little bit of time, but millennials actually are financially not as well off as their parents were at the same age. 34% of them have household incomes of less than $30,000. And, part of the reason, they're also still working, but they probably are working less hours and making a lot less money. 50% of informal caregivers say they had no choice in taking on the caregiver role. Now, I would hope if you're talking to clients and ask them if they've been a caregiver and ask them, did they have a choice? Ask them how it affected their life, because you can actually get them to sell themselves a policy if you simply go through the steps. Don't tell them what the chances they're going to need long-term care. They don't care about that. But if you just simply say, did you ever care for a family member? And they tell you yes, well, how did that affect your life? Did you have a choice in the matter? Did you have to quit your job or take less hours? How did it affect your family, your children? Were you having to spend less time or missing some of their soccer games or whatever? Anyway, just have that conversation. Next thing you know, they're going to say, oh my gosh, I don't want my children to go through that. Now, the big talk right now has been the Washington Cares Fund. So it's, that's a done deal. That ship has sailed. Why does it matter now? Well, one thing is it did get delayed. That just happened, I believe, yesterday. The governor signed, the two legislations, the House and Senate passed it, and the governor signed it, I believe, yesterday. While it's the first program to be actually implemented in the US, the voters didn't want it. They rejected it twice. People don't want this. It's the government that wants it because they think it's going to save their Medicaid budgets. Whether it does or not, that's another question. And the truth is, private pay keeps the long-term care industry healthy. And the reason for that is because programs like this, including the Washington Cares Fund, is going to reimburse facilities and caregivers, most likely at Medicaid rates. And often those rates aren't enough to even cover the cost of the care. So who keeps these businesses in business? The private pay patients. If you don't have a high percentage of private pay patients, the industry will crumble. And so that's, the voters don't even realize that necessarily, but But these bills sound good on paper, but if you really think through the whole thing, they're need to make, they're not, they shouldn't be, but they're trying to cover too many people, at least according to some of the people I truly respect and their analysis of the situation. But it's not going away because other states are interested as well. Now, the program deductions were supposed to start January 1st. They're being delayed till July 1st of 2023. Assuming they don't raise the cost before they even start the program, it's supposed to start at 0.58%. So it's 58 cents for every $100 for W-2 employees. The program has to be financially sustainable. To keep it sustainable, the tax can go up. And while benefits are supposed to be adjusted upward, they can go down if that's what has to be done to keep the program sustainable. It provides a total of $36,500 in benefits after qualifications are met. Now, one of the things that bother me, Charlene and I were actually texting or emailing about this last night. Washington put out yet another of their public papers that is very misleading. They're implying that there is a lifetime benefit of $36,500. That's how they state it. Well, most people would read that as $36,500 a year for life. That's not what it is. It's $36,500, and it's available to you your whole life to pay for a long-term care event. It's not a lifetime benefit. It is a benefit available to you over your lifetime. They had a one-time offer to opt out. That ship has sailed. The policy had to have been purchased prior to November 1st. But the people who have their policies have until December 31st of this year to get their exemption application in. So why does this matter outside of Washington? Because there's other states looking to do this as well. And the hot one is California. They actually see a lot of the problems that Washington had, and they are trying to correct those as they look at putting a program in place. Now, the rest of the states you see here on this list so far are in a wait and see. In other words, everybody sees that the Washington program is a mess. That's why it got delayed. They need to fix it. And California recognizes the problems. In fact, they recognize more of the problems than Washington recognizes. And so California is trying to build one that is much better. So these other states are kind of like, well, let's see what Washington and California do. So they're kind of in a wait and see mode right now. Now that could change, but as of literally this morning, this is a wait and see list other than California, who is in the early stages. Now, California is not projected to have anything going for at least 2 years. But here's what I will tell you about California. If you do business in California, you need to start contacting those clients now. They are pretty clear that if they offer an exemption and they realize for purposes of optics, they may have to, they likely will only offer it to people who had insurance prior to the first signing of the bill. That means the day the governor signs the bill, the first time, the first go round, that may be the cutoff date. So if you've got clients in California, start talking to them now and getting these policies put in place. Now, there's also some federal proposals out there. I'm not going to go into detail on all of them, but I want you to be aware of them. 2 of them in particular are of interest because of how they could influence other potential state programs. The first one is the WISH Act, otherwise known as the Wellbeing Insurance for Seniors to Be at Home Act. And this is this one is, it looks similar to Washington in the sense that it's a 0.6% payroll tax. They will tell you the employee is only going to pay half of it. The employer will pay the rest. But my experience is when the employer is paying for anything, the employee ultimately pays for it. with less of a race the following year. So I don't know how you want to categorize it, but it's a 50-50 cost share in theory. The benefit is going to be $3,600 a month, adjusted for inflation. They have not stated how long it will last. There's no reference to that. We don't know. We don't know if it's a year, 2 years, lifetime. We don't know. But you have to work 40 quarters to qualify for full benefits. But if you work at least 6 quarters, you will have a pro rata benefit. But here is the catch. There will be an elimination period of 1 to 5 years, and it will be means tested by income. So with a 5-year wait, the highest income individuals will pay that tax and get nothing. They'll get nothing. Your clients are likely in that 2.5 to 5-year waiting period. This act will do nothing for your clients, nothing. Even the poorest of clients, even the poorest of people are going to wait a year. Those people will either get well or die, and they'll get nothing either. And then when you go beyond that, the average claim of a claim that lasts 1 year will last about 4 years. Now, of course, it takes people having a claim for 6 or 7 years to get to the average of 4. But the point is, a lot of people will never get any money from this. This one actually might be financially sustainable because they won't have to pay a lot of people the way they have it set up. Now, the next one is the one that excites me. Those of us in the industry have spent years trying to talk to the legislatures in the Senate and House. I had the pleasure and honor of getting to spend 30 minutes a couple of years ago with one of our congressmen talking about this very idea, and it has now been proposed in the Senate. If you know people, in other words, do you know your senator? Even do you know your congressperson? Do you know people who know your senator or your congressman? Talk to them. Get them to tell the senator, we really need this, or the congressman, we really need this. It's called the Long-Term Care Affordability Act. And if passed, it has not been passed, but if passed, it would allow you to use qualified money to purchase long-term care insurance. And the good news is that includes riders on life insurance and annuities and linked benefit policies. You would have up to $2,500 a year, which will increase each year, that can be used to pay premium, and the funds would then not be subject to income tax or pre-59.5 penalty tax. This bill will promote the purchase of private long-term care insurance, and that's what we need. We need to keep the private market healthy, because the healthy private market means a healthy long-term care industry where everyone, including the people on Medicaid, will get better care. So we want to promote private pay. That's what's best for everybody. Now here's 3 more proposals. I won't go into a lot of detail. The first one is a combination of focusing on caregivers and people in general. It's sort of a let's just throw in everything and see what sticks act. It would expand Medicaid to home and community-based services, increase wages, increase benefits for care. It's just going to increase everything and supposedly be paid by the home and community-based services budget, the HCBS budget. It would be $400 billion out of the federal budget. I don't know that that's going to go through. It's kind of pie in the sky. There's a Credit for Caring Act. This would help caregivers by giving them a non-refundable tax credit up to $5,000 to help them with out-of-pocket expenses that they are paying to care for a loved one. And then the Social Security Caregivers Credit Act for people who've had to either cut their work hours substantially or quit their jobs. It would give them credits, financial credit toward their Social Security, so that their retirement benefit is not devastated quite as much. Now we're going to do updates with long-term care planning. So why buy now? Well, the underwriters are learning a lot about long-term care. If you think about life insurance, it's been around for centuries. I mean, some people would even say millennium. There's evidence that insurance was being used 2,000 years ago, but from in modern times, it's several hundred years old. Underwriters know what they're doing, but the long-term care industry really only started in the 70s. And it took a few decades for them to learn what they needed to know to underwrite correctly. So the underwriters definitely have made some changes. And if you look at this list here, declines are going up. Who would have thought declines for a 50-year-old would go up 286% since 2012? So it's about 19% of people below 50 are actually declined now. Now, these are traditional long-term care policies. Between 50 and 59, you still have it's about 22% over 1 in 5 are declined. You think of these people, of your automatic approvals, they're not. You get to 60 to 64, over 1 in 4 are declined. 65 to 69, over 1 in 3 are declined. The only category that has stayed the same is the age 70 plus. It's always been around 45% are declined, and they still are. So you want to get these people before they get to 70 for sure. But the younger, honestly, it's not a sure thing even for those people below 50. But there is good news. Declines for linked benefit applicants are 25 to 50% lower, again, depending on age, than traditional long-term care, 50% lower. So again, linked benefit policies and combo policies, could definitely be a better way to go. There's also a financial cost of waiting, especially if you're looking to put inflation on the policy. So not only would it cost you more, but if inflation is part of the plan, the longer you wait, the less time there is for a policy to inflate. So if you start with a 55-year-old, now each one of these categories is going to start with a $5,000 a month benefit and purchase a 3% compound inflation 6-year benefit period and pay over 10 years. Now, if you're 55 and you buy the policy, your annual premium will be $13,000. You're done in 10 years. You've paid $130,000. And at age 80, you will have over $10,000 in benefits. If you wait to 60, okay, not so bad. I mean, your benefit at age 80 will be $9,000 and change. Your premium will go up to $5,200. And yes, you'll have paid a total of $18,000 more for the policy. But one could argue that isn't terrible. But now look what happens if you wait to 65. Your monthly benefit at age 80 is down to about $7,800, and your annual premium is over $18,000. And so now we're looking at, about 50% higher for less coverage. And if you wait till 70, that's just devastating. So there's not a lot of growth by age 80, and you've paid $267,000 for less benefits than you would have gotten if you had just done this at 55 or even 60. So waiting is not good. And remember, people's health have you ever met anybody whose health improved with time? I mean, the only time you see that is someone who's had a devastating illness and was miraculously cured. No, your clients in general, their health is not going to improve with time. So waiting is not good. Now, besides Washington being a hot topic, the HIPAA per diem has been a hot topic this year for an unusual reason. And that's because for the first time ever, it went down. If you look at the chart here, you'll see 2022, first time ever decrease. Now, people are wondering what on earth happened, especially since clearly we see inflation, and I forget what they call it. There's another one where it's another name for inflation, but it's where they charge the same amount for the box of cereal, but they cut the size of the cereal down by an ounce. So we're seeing all that going on. Why would HIPAA go down? Well, the reason is that in 2017, when the Tax Cuts and Jobs Act was passed, they changed the formula of how the HIPAA per diem would be calculated. Now, it wasn't just the HIPAA per diem. It was anything that had a fixed amount. Unfortunately, for most of these categories, it was helpful. The HIPAA per diem saw a little collateral damage. It was not necessarily helpful. So what happened then between 2017 and 2018, the HIPAA per diem just stayed the same. Then it kept going up. In 2021, it went up by $20 for the first time. Everybody was very excited. Then in 2022, it went back by $10. They are still getting the formula adjusted. In comparison to the old formula, they're still trying to find that sweet point to go forward with. Now, some people were panicking, but don't. Let's look at the chart again. Between 1999 and 2000, it didn't go up. Between 2014 and 2015, it didn't go up. And between 2017 and 2018, it didn't go up. If it had only gone up $10 in 2021, we'd be in the same place today. It just wouldn't have gone up. So did we really lose anything? I would argue no. To me, it looks more like one of those 2-year spans where the HIPAA per diem didn't go up. And the truth is, the majority of policies sold today, the benefits do not exceed the HIPAA per diem. So it really doesn't matter. You might hear some people trying to scare you into saying, oh, you need to stop selling indemnity policies because the HIPAA per diem is in turmoil. No, it's going to keep going up with time. And most people do not have a policy that will ever exceed the HIPAA per diem. And even if they do, if your expenses also exceed the HIPAA per diem, they're still tax-free. The benefits are tax-free to the greater of the HIPAA per diem or your actual cost of care. So again, while everybody got upset about this, in reality, it's really not a big deal. Now, what about maximizing the value of a linked benefit policy? This is counterintuitive, folks. Again, as I mentioned earlier, a claim that lasts 1 year will average 3.9 years. We'll round it to 4. We get a lot of sales coming in the door for a 4-year benefit period. And even if you ask people, why did you choose 4? Well, that's the average length of care. Well, it is, but the most popular sale is a 6-year benefit period. And here's why. For the identical cost, a 6-year benefit period will pay much more in total LTC benefits than a 4-year benefit period. You're probably thinking that's counterintuitive. It should cost more, but it doesn't, because we know that the chance of us having to pay in year 5 and 6 drops substantially. The monthly benefit will be slightly less, but the back end will be a lot more. The break-even age is generally 4.5 years. Now, if you look at, well, what if my claim is only 3 years or 4 years instead of 6 years? You might lose $30,000 compared to what you would have had if you bought a 4-year plan. But if you buy the 6-year plan and your exceeds it, you'll end up with benefits of about $130,000 more. That's why I'm saying the bottom risk is very small, but the upside is very large. That's why I have a 6-year benefit period. I've done the analysis, especially for women. Women are on claim 50% longer than men. So it really makes sense to sell a 6-year or even 7-year benefit period to the women. Now, you may have heard in the past that 5 and 7-year benefit periods weren't as good a deal. They weren't under the old structure. Today they are. I just would encourage everyone, do not stop at 4 years. Go at least 5, if not 6 or 7 years. You will find the upside is very attractive. And then, of course, inflation options help keep up with the increase. And the choices are 3% simple and compound, 5% compound, and U.S. medical care inflation. Now, link benefit policies become much more affordable. And again, currently they're 30% of combo sales today. They used to be thought of as long-term care coverage for the affluent and the wealthy because you had to have a single pay. That's why they were called asset-based products. You were repositioning an asset. Today, they've become much more affordable. There was that interim period where you had up to 10 years to pay for it, but today we have schedules that are paid to 65 and even paid to age 100. Paid to age 100 is generally only available to people who are 65 or younger. However, just keep that in mind. But, you know, honestly, at this point, a lot of your clients can now afford these policies. Now, we've talked a lot about things that have changed, but some things remain the same. And that's that many affluent clients will tell you that they're going to pay for long-term care themselves. In fact, they're going to tell you they're going to self-insure. Well, there is no such thing as self-insuring. The definition of insurance is the immediate leverage of a dollar, and you can't immediately leverage your own dollar. But what you could do is self-assure. So we have an idea you can show clients. Again, you're going to get this presentation. And you simply on a yellow pad, this is not a client approved presentation, by the way. So you're going to do this on a yellow pad. On the left side, you write self-insure. And I put it in quotes because, you know, you're going to make sure they know they can't immediately leverage their money. And then on the right side, you put self-assure. Now, Mr. Smith, Mrs. Smith, you're looking, we're going to keep the numbers real easy here, but let's say you put $100,000 in a safe investment, a money market, something that's not going to really be hit by the market. When you need long-term care, you're going to go get your $100,000 and that little bit of growth, and you'll have cash, and you can do anything you want with it. The problem is when that money runs out, you are going to be having to go either to your income or assets to keep paying the bills. And it may not be a good time in the market to take money out, or your income sources may have depleted at that point. So what I would propose to you is what I call self-assure. We're going to take the same $100,000 you were willing to set aside. We're going to put it in a linked benefit policy. Now, the reason I like this is because you can't lose that money. That $100,000 is going to be immediately leveraged to whatever it is that would leverage them. I have $540,000 here in the example. If you never need that policy, here's your death benefit. Now, if your clients are on the older end, it's going to be what they paid into it. The point is they can never lose. So if you don't need the policy, at your age, there would be $180,000 of death benefit. If you do need care, the first $100,000 you receive will be your money. So would you agree you just self-fund it? However, this plan allows for a stop loss. You're not going to pay any more of your money after the first $100,000. The insurance company is going to pay you the next $440,000 out of their pockets, not yours. You'll get $7,500 a month. And by the way, even if you go through all the money, your heirs are still going to get another $36,000. The idea is, don't make this sound so much like long-term care planning, but use investment language, the stop loss. We're doing this, we're doing this because I want a guaranteed stream of funds off to the side, not tied to the market, that will protect your portfolio from having to be touched, whether the market is down or the market is soaring. We don't want to go to the portfolio. We want a dedicated stream of income off the side. And if you present it as insuring the portfolio instead of the person, that very healthy, affluent client who thinks they're immune from long-term care because they have money, they have the best gym in town and a personal trainer, and they can afford organic food, they're going to realize this isn't about them, it's about their portfolio. And everybody likes to protect their portfolio. So what can we do at Nationwide to help you? Well, people need long-term care resources, and we have a full suite of solutions. Not only Care Matters, but we also have the long-term care writer on our life insurance products. And you can set up, there's pretty much a way from every product we offer to get a guarantee if they want a guarantee. Our people want flexibility in their solutions. All of our products are cash indemnity. We do not place any restrictions on how those benefits are used. People want guarantees. So again, some of our products automatically come with guarantees, the ones that don't. Most of them have a rider that will give you a guarantee. And the value of cash indemnity, how can I talk enough about that? Again, we place no restrictions. This can be used to pay family and informal caregivers. And think about your high-end clients. Reimbursement plans don't necessarily pay for concierge and alternative care services. They don't have to worry about that with our policy. In fact, with some high-end clients, we have found they will buy a policy to get the care coordination service. So we have the nationwide care network where we will help your client with their claim. If they don't have a way of getting an assessment or a plan of care, we will help them get that. And then that service also will help them in planning what kind of care they want to have and where they can access the best quality caregivers. So sometimes high net worth people will buy the policy just to get that free coordination service. I do have to tell you this. I was on the phone with one of my advisors that I talk to kind of regularly, and he called me because he knows I like to tell stories. And he says, I think your audience will like this one. So one of his wealthier clients called and asked if she could come in and talk about long-term care. And he said, I'm kind of surprised. I mean, you're worth she was worth, like, we're talking $20 million. But she had 5 children. And she said, I do not want the quality of care I receive to be dependent on the inheritance my children think they're going to get. Now, I don't know what that says about her children, but she did not want the children to be making decisions about her care on the basis of preserving their inheritance. So she felt her best chance of getting the best quality care was just to have that dedicated stream of income that was only for long-term care. And so she bought a very nice policy. Cash indemnity allows you to pivot your care literally with COVID, people have had to pivot on a dime. All of a sudden, we need to bring mom home, and I have to work from home, and we're able to do that because, again, we don't ask you what you're doing. There's no permission needed. There's no bills, no receipts. It's so valuable when you need to change your plans quickly. If you need to reduce your work hours by 20% because you brought your mother into your house, she can pay you. And you can collect the full available monthly benefit. And that's important because it's going to pay for ancillary expenses that are not covered by a reimbursement plan, such as transportation, or maybe you have an expensive medication. You can use your LTC benefits to pay for that medication. Or you can just save for future higher costs in the future and help reduce out-of-pocket expenses. Now, the other thing is people want tax breaks. Care Matters 2 only has HSA eligible and potentially tax deductible. Businesses really want tax deductions. And again, Care Matters 2 only has those LTC premiums that are eligible for a tax deduction. The business will get the deduction. It's just a matter of how much of a deduction based by the business entity. These are my favorite cases to work right now. We're having so much fun with these. If you have businesses, your one contact can turn into 8 cases. I'll give you an example. We are on a regular basis, and a financial professional is talking to his client, who's a business owner. Turns out the business owner has 3 partners, and he says, can you come back and talk to my partners? Everybody's on board, and they include the spouses because they can. Next thing you know, there's 8 cases coming in off that one contact. If you don't know if your client is a business owner, ask them, because they don't have to jump through the hoops of fire that individual taxpayers have to. If they're a business owner, they will get the deduction. It's just a matter of how big and how it's done, but it will absolutely get done. And then the high net worth, they need estate planning options. You think of the people that have estate planning issues as people who can definitely afford to self-fund, and they can, but they're in a unique situation that if they self-fund inside their estate and they die in their sleep and never use that money, they're going to pay unnecessary estate tax. Their estate will have unnecessary estate tax. So we have a way of putting a long-term care into a cash indemnity long-term care into an islet, so we can prevent that unnecessary taxation. And we do have, again, a full suite of cash indemnity solutions, whether it's Care Matters or the LTC rider on life insurance. We can help you with those estate planning cases. These are the products that we have. The LTC rider, there's a New York version. We have LTC rider 2 in every other state. We do not sell long-term care in Montana, just an FYI. We have the long-term care rider on our survivorship IUL, and then we have Care Matters 2, and then the older Your Life Care Matters in California and New York. All of these products pay cash indemnity benefits. So just to summarize, the long-term care market is shifting to combo and hybrid sales. And they're shifting because of guaranteed premium and benefits. The long-term care story now centers around home care. And, we're going to have to wait and see what happens with the proposed state and federal programs, especially the California and Washington situations. Keep in mind, waiting to purchase brings risks of higher cost and declines due to health. But we at Nationwide are here to help you. We have a full suite of cash indemnity solutions, and we can't wait to help you help your clients with a good long-term care plan. So Brittany, we can go ahead and open it up to questions now.
All right. Well, thank you, Sean. We got several questions about the presentation. Yes, we have this recorded. By attending today, you will receive an email from the GoToWebinar system with a link to the replay. So this is going to be at your hands, on demand, if you would like to come back to some of the information we presented. Now, we just only had a few individual questions. I'm going to go ahead and reach out to you personally. With Sean feeling under the weather, we're going to let her get going. But I want to thank everyone for joining us today, especially Sean. Thank you for piloting today. I know you're feeling under the weather, but you did amazing.
Thank you.
You're welcome. For those of you after the call, if you think of any other questions or would like a one-on-one discussion regarding long-term care, feel free to reach out to our team. Number's 800-228-0008, or send us an email at ltci@jetter.com. Everybody, enjoy the rest of your day. Have a great weekend, and we'll talk soon. Thank you.
Thank you. Bye-bye.